My name is Teri Ridlon. I am a nurse practitioner at the Wind River Clinic, which is right next to the hospital on College View Drive. November is Lung Cancer Awareness Month, so I wanted to talk to you a little bit about lungs, not just lung cancer. How do you know if you're at risk for lung cancer, and what can you do to screen for it? You're definitely at a higher risk of lung cancer if you're what we call a 30-pack year smoker. That means that you smoked a pack a day every year for 30 years, or that you smoked 2 packs a day every year for 15 years. Gets a little bit more complicated, don't make me do the math, but if you've been smoking for 45 years and it's less than a pack a day, you might still be a 30-pack smoker. If you're between the ages of 55 and 77, we can do a screen for lung cancer. It's called a low-dose CAT scan screen, meaning a low dose of radiation for you. That's looking for something called pulmonary nodules. Pulmonary nodules do not always mean cancer. They can be caused by inflammation, infection, and cancer. Tiny nodules, we're not really concerned about those. We just want to check them again in another year, because the important thing is if it's really, really tiny, but then it increases in size to the next year and it's in the same place, then we want to check those out. If you have nodules that are bigger than 1/2 inch, we always want to check those out right away, especially if you have risk factors. If you're wondering about symptoms for lung cancer, a chronic cough that never goes away, fatigue, but you might want to put that with the cough, chest pain sometimes, having trouble breathing, and all of those are things that you would want to talk to your primary care provider about, so that we can tease out if that could possibly be a concern for lung cancer. I am a firm believer in giving you as much control of your health care as possible. If you have asthma, this is a standardized form, but done by the American Lung Association. And what it does is it gives you your green zone. This is when you're doing well, your asthma's well managed. Your yellow zone, your symptoms are not quite well managed, but there's a plan on here of how to get you back to the green zone. Our goal is to never be in the red zone, but if you're in the red zone, that means you need to get to the ER or get seen right away. The other thing I have here is called a COPD action plan. Uses a little bit different measures. Sometimes we even have an as-needed medication that you would take automatically if you have a COPD flare that's beyond what your normal routine medications are. But both of these give you some control with the goal of trying to keep you from having to go to the emergency department. If you're using one of these as part of your healthcare plan, and these are standardized plans that you can always talk to your primary care provider about. I use them routinely for my patients. But if you do use one of these, it's super important to talk to your provider if you're in the yellow and are making those changes from the yellow, because we might need to see you anyways, because our goal, keep you out of the red, keep you out of the ER. So come see me if you want any help with any of your healthcare needs or if you have any concerns.